This here is the indirect setup for the inside incognito hidden braces. As you can see, they fit nicely over the teeth, and all the braces will be glued on all at once as opposed to one at a time. They are custom made for the specific patient. Here we have your teeth as they are now, and the incognito system sends us what your teeth will look like when they're done. As you can see here, the teeth nicely interdigitate with one another, and you can see the difference before and after. So we're going to try in the upper tray first to ensure that it fits well. As I mentioned, these are custom made just for you. We're prepping the teeth. As I mentioned, this is not a needle. This is just used to squish out a teeny tiny bit of material. Now we're going to rinse away the material. Open wider for me, please. We're going to suck up the majority of it. Now we're going to use lots of water. Keep your eyes closed, and it may taste a little bit sour like lemonade. Now lots and lots of air. It's going to feel cold. And I'm going to be placing some primer along the teeth, just like how we did for the lower. And while I do that, Sammy is going to start mixing. Sammy is using a type of glue that comes out of a syringe, and it mixes the two components together through the syringe tip, and it gets placed over the brackets, just on the base. So that way when I place the indirect setup in the mouth, it rests perfectly in the correct position with glue on it, ready for bonding. Now that the teeth are all prepared for the braces, I'm going to take the tray and place it securely over the teeth. Good. We're going to use the ultraviolet light once again to harden the glue. Now I'm going to remove the first layer of the tray. Another round of the blue light. So the next layer to come off requires a little bit of pressure for removal, lots of pulling and peeling. It's a little bit tricky because of the hooks of the braces, but nonetheless comes off. The last one all the way in the back. Voila! The incognito system is an excellent system that is custom made for you. So as you can see here, there is a wire that is custom bent for the particular patient. So now we're going to place in the upper wire like so. Prior to doing so, the incognito system requires little ties to be placed. So as you can see here, I'm just placing it around the hook of the brace, and that is done across the front, and different ties go on the back after the wire is placed. So the wire is labeled on the diagram with the left and right. So I place the left side of the wire into the left braces. The back brace has a tube for the wire to be placed into. So the wire goes into the slots of the braces. And is held in place with a tie, whether it be an elastic tie or a metal tie. So all of the front teeth are tied in to the vertical slot, and all the excess of the tie will be cut off just like so. So all the front teeth are done. For the back, they have a horizontal slot and they require a metal tie. Sometimes an elastic tie can be used. So we ensure that the wire is in the slot of the brace, and the slot of the brace is where the prescription is for tooth movement. The ends of these ties are cut and tucked into place for comfort. With eating and brushing and flossing, sometimes these ties do poke out. So what you can use is the eraser end of a pencil to gently push them away from the tongue towards the tooth. Just like so. In the beginning stages of incognito, sometimes little elastics are placed around the hooks of the brace for comfort.